I'm Marthel Neville. Time now for Sunday House Call.
And I'm Eric Sean. Welcome, as always. Joining us, Dr. Mark Siegel, professor of medicine at NYU's Langone Medical Center and author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health.
And Dr. David Samadi, chairman and professor of urology at Lenox Hill Hospital and chief of robotic surgery. But we're going to begin with this breaking news this morning that another person in the United States has tested positive in preliminary testing for Ebola. Dr. Siegel, hello to you, sir. And tell me, they're reporting that there's a possible breach in protocol. What could have happened here?
Well, first of all, we have to understand that this was a healthcare worker. This was a nurse that was caring for Duncan. So this is somebody directly involved with Ebola secretions, and she was wearing the proper suiting, but the problem is that she may not have put it on properly, she may not have taken it off properly, and up until this point, Arthel, the Dallas health officials have been directly involved with overseeing this, and I'm one of the people now saying I think the Centers for Disease Control just has to take this over, because this can happen. And you have to understand, if you're putting on a suit that you're not familiar with, and we don't know all the facts yet, and you have secretions all over the place, blood, vomit, diarrhea, all the things we've been talking about on the show here. If you don't follow the protocol 100% of the time, you can come in contact with those secretions and catch Ebola. Now, the test that was done is a preliminary test, but it's about 95% sensitive. The CDC will confirm it. It's causing a lot of panic, but I want people out there to know this is someone that was in direct contact with an Ebola patient and Ebola secretion.
And first of all, we're not blaming this health worker for it's not her fault.
Right.
Not we're saying that. She's doing her job there,
right.
Trying to work out. Dr. Samadi, bringing you into this because people are wondering, sure, this lady's a health worker, but she has a family that she's in contact with. So again, we're not trying to incite panic, but you tell me your take on this.
Well, my take is totally different, and I think someone said that you are the only doctor so far that has talked about closing the flights out. I have no problem with America saving the world. I have no problem with us sending humanitarian, our soldiers, building all these Ebola treatment centers over there, but there are a lot of rituals and burial rituals. There's a lot of things that are coming out of there, and we don't completely understand Ebola. You have to tell me how exactly the NBC cameraman got Ebola just from shooting the video. You have to tell me how the nurse in Spain, excuse me 1 minute, how she was able to put the gloves on her face and got Ebola.
We're not talking about that case. We're talking about the nurse in the hospital here. You're going to incite panic here, David, on national TV. We don't know how this NBC camera person got it. How can you speculate that? You weren't there. We don't have direct information on that. We're talking about Thomas Eric Duncan.
Wait a minute. You know what concerns me?
The easiest thing would have been...
This is what is inciting the panic.
No. Nobody is starting any panic, Mark. You have to...
guys, doctors,
we got to focus
what concerns me is that first we're told it's body fluids, vomit, blood, this sort of thing, fluids. Then we're told, well, maybe the virus can survive on doorknobs and countertops for a few hours. Then the nurse in Spain has the glove, touches it to the mucosa, maybe on the eyes, and now, sadly, this nurse in Texas may have not followed protocol. So the deeper question I think our viewers want to know about is, do we know exactly, Dr. Siegel, how is it spread? Should we worry? If you're not a healthcare worker, is it confined just to that? Can you sit on a bus or an airplane and pick up Ebola? Is it overblown? What do we need to know? The facts, not the fears.
Well, here's the facts. The facts is we've known this virus since 1976, and healthcare workers are always the ones most at risk and the people most in contact. What I'm concerned about the reaction out there is that if I say to you, you could get it sitting on a bus, everyone out there thinks that's how you are getting it. The way you generally get it, 99.9% of the time, is being in direct contact with the secretions of Ebola. There's no evidence that that's changed. And I'm not surprised to find a healthcare worker getting it. Someone that, we saw that with Brantley and with Reipel. It's the same thing. They were taking care of Ebola patients. They were wearing protective clothing, but they probably didn't use it exactly right.
I want to bring Dr. Samadi back in. I understand Dr. Siegel's concern about not inciting fear, but to your point, Dr. Samadi, I think there are people out there who have that same questions. Why aren't we at cutting off these flights from these countries at the moment, from people coming in from those countries where it's just an outbreak there,
well,
outbreak. Okay.
You have to let me speak, because if I can't get the word out, then there's no issue to do this. You don't have any vaccine right now, right? The vaccines are going to come in the next few months. You're not prepared to have the ZMapp antibodies, monoclonal antibodies. All I'm saying is, until we get our emergency rooms ready, until we get our act ready, until we understand exactly how this virus is going to spread, I will tell you, Mr. President, bring up those walls. Control the flights out. You have to protect the Americans. This whole thing about we're going to be okay, we're going to be okay, there will be no more number of Ebolas. This is not to create panic in America. Listen, they did a great job. CDC did a great job with SARS. They had everything online. Wear your mask. The airlines were ready.
They stopped flights in Toronto, in Canada.
So if CDC is not worried, they should not say 1.4 million people are going to be affected by this in January. And you know how they're counting these numbers? 8,000 people diagnosed, 4,000 people dead. You tell me how they're counting these people when you have dead bodies in Liberia with mosquitoes.
Let me just get back to the airplane just for a second.
We have to protect the Americans.
Can someone be infected with Ebola, take Tylenol, keep your temperature down, be tested there, fly in the plane, get here, have Tylenol, keep your temperature down, have Ebola, and sneak through the system?
Somebody comes to JFK and throws a vomit. Who's going to clean this up? Can you tell me who's going to take care of this? We don't have these suits running around. I'm with him. But you have to understand, until we get our act ready, until we are prepared, keep the war over there. America is a beautiful country. Listen, we're not saying ignore them. We are saying sending troops. We're sending our health care. These people, our own troops, can come back. We're building Ebola treatment centers. We don't want people to panic. But I also, as a doctor, have to take care of my patients and families. You're right. This nurse probably exposes other doctors, other nurses, and this has potential to become epidemic. We need to educate people. That's all I say.
The issue of, I want to talk about the issue of plane flights for a second, because I really want people to understand this scientifically. If the fear quotient goes high enough and the money quotient follows, we're going to have to do this. We're going to have to close off the flights. So far we got one patient, one person that slipped in, one person. The second one got it from him, and that person's being isolated. One person. Did you know that 2,000 cases of malaria come in every year because there's 20 million new cases of malaria every year, most of them in West Africa. We could close the airports for malaria because it's getting a lot of people sick here. It's causing $43 billion to take care of malaria patients here in the United States. $43 billion last year.
Yeah, but there's also cost a lot to take care of.
We can close flights because of malaria. There's 2,000 patients a year coming from West Africa with malaria, and we have to take care of them. Ebola is a very difficult virus to catch. We're going to have to close air travel off because of the fear and the panic. Not because of one case, because of the fear and the panic. And if we do that, I predict, and others
but that doesn't make any sense. Fear and panic doesn't cause Ebola.
One case.
Everything starts with one case. Now we have two cases. We have Spain.
This is part of the heated debate. You can tell right now between these two medical professionals how contentious this issue of Ebola can be in terms of the facts and the fear and what's going on.